illnesses are universal. Everybody has that. Personal disabilities are people who have a higher health need but are now facing higher challenges in accessing healthcare as well as accessing health insurance. So they are at a superior risk of being pushed into poverty, facing catastrophic health expenditure by a single health problem episode.
Even if this provisions is there, there is no effort to create, that capacity amongst the insurance companies to make it available for people with disability. There is no outreach from the insurance companies to sell that product. For an insurance company, I think all the time they are target driven. They are trying to reach out and sell an insurance product to people in general. But unfortunately, so many of insurance companies who have launched this specific product for people with disability, which has a coverage of up to 5 lakh rupees. There's no outreach, and it has not been used because the premiums are very high. Its affordability is a question. Considering there is an existing condition which is recognized by the law in this country, and there are clear directions from the High Court and IRDAI. Still, I don't see any effort from the insurance company in particular to make a genuine outreach to people with disability in a country which has the highest number of disabled people living in.
New policies have come out now, IRDA guidelines have come out now, but still they are not giving insurance to persons with disabilities. Today, I am a financial consultant. I can afford even a 50 lakhs insurance cover. I can afford, a 50 lakhs insurance cover. But still they do not consider, health insurance companies are not considering me for even a 4 lakhs or 5 lakhs cover.
मेरा एक बच्चा है जो श्वसन में प्रॉब्लम था. मेरा जो आयुष्मान कार्ड बना, आयुष्मान कार्ड के माध्यम से मेरे जो बच्चा है उनको हॉस्पिटलाइज में भर्ती करवाया. तो वो ये जो आयुष्मान कार्ड है, आयुष्मान कार्ड के माध्यम से मुझे मेरा बच्चे का इलाज हो गया. मैं जागरूक हूँ तो ये हो चुका है. बाकी ऐसे जो विकलांगजन हैं ग्रामीण स्तर पर जिनको पता ही नहीं है, उनको कोई लाभ ही नहीं मिल पा रहा है.
I think the government should invest. I think if you look at this, education is a fundamental right in India, and I think India is slowly also moving towards making health right as a fundamental right. We're slowly moving in that direction, and this coverage of PM Ayushman Arogya Yojana, which is already covering more than 12 crore people in this country, is an indication that we are slowly moving towards that. And I think we cannot leave behind people with disabilities and their families. And there is a Niramaya scheme, which is covering certain number of people in India that Avilino will be able to share.
That's a really good point, that we can't keep looking at it from a commercial, profit-centered perspective when it comes to this issue, because we have to look at it from a justice perspective.
The National Trust, as you know, it covers 4 disabilities, which is cerebral palsy, autism, intellectual disabilities, and multiple disabilities. And Niramaya has got this, National Trust has got this Niramaya scheme, which gives a 1 lakh limit. Up to 1 lakh you get insurance. And this scheme was started many years back. But it has many sub-limits also. You cannot claim above certain limit for the expenses. Like for corrective surgery, you have limit. For hospitalization, you have limit. For OPD, you have limit. But if you see as of today, that 1 lakh is not sufficient. We have been trying to increase that 1 lakh limit to up to 5 lakhs at least under the Niramaya scheme. These sub-limits have to be removed. The total sum assured limit has to be also increased. And coming to the implementation of the scheme, there are problems where people are finding difficult in claiming the getting reimbursement under the scheme. As you know, there is a third party involved in the Niramaya, that is the Oriental Insurance, and the scheme is funded by the National Trust. So many times there is always passing the ball between the TPA and the National Trust when it comes to claim settlement. Hospitalization is one thing, but the main thing for the corrective surgery is the implant, which will help to do the corrective, which will help to correct the posture of a person with cerebral palsy. Okay, that is not covered. Then how do you say corrective surgery is covered?
As far as Ayushman Bharat is concerned, it is given only to people who are under poverty, whereas senior citizens above 70 are covered from September 2024. So I would say that it will be our ask to cover all the persons with disability. Now, as far as private insurance is concerned, this particular scheme, which was mandated by IRDA on 28th February 2023, it's compelling all the insurance companies to come out with insurance policies which they have. Again, there is a problem about accessibility and all. However, in that policy, there are couple of issues, lacunas. In that, this policy is open only for people with benchmark disability. So now many people who are having invisible disability, like multiple sclerosis, thalassemia, and so on, so they will never get benchmark disability, that is a 40% disability certificate. So they are completely excluded. My ask is, why we should insist on benchmark disability when the premiums are high? Who is a fool to say that I am disabled and he is not? Absolutely not, because what is the benefit in getting that policy when you have to pay higher premium? So this type of absurd requirement should be removed. We need to ask, how many policies have been issued since the inception, that is 28th February 2023. As far as sanction ratio is concerned, what is a claim ratio for that and sanction ratio? Because that is important information, because on that basis underwriting is determined. So we need to ask this technical question to IRDA.
So that means the National Trust scheme is also extremely limited. One is that there is Ayushman Bharat, but that does not cover a person with disability unless they are poor also. But when it does cover, there's a tangible impact on persons' lives. Second is the IRDA, where there was a regulation saying that persons with disabilities must not be discriminated when it comes to private health insurance, but that is also far from implementation. And the third is the National Trust Niramaya scheme, which is very limited. Only 4 types of disabilities are covered and very limited. So why is this happening in the government? What is causing this delay in making health insurance accessible for persons with disabilities, and what can be done about it, in your opinion, ma'am?
The challenge is really broad. We just cannot narrow down it to the insurance and why the implementation or why the coverage is poor, or, it is very multi-sectorial and multifaceted, and the reasons are too many. There's one particular report recently that I was going through. It talks about the household expenditure coverage with disability and without disability, and they have considered some 13 indicators, and the top one is the healthcare. And as WHO says that you are under the trap of poverty trap, which means that the disability and poverty are very much linked and associated. India has done a great policy stride, and so whether it is IRDA that he has talked about, or it is about the Mental Health Care Act 2017, or about that Rights to People with Disability 2016 Act, or it is HIV/AIDS Act 2017. All these acts definitely prohibits discriminations, and it protects actually the rights of the people with disability for healthcare accessibility, because there is a fund flow mechanism which is going on very smoothly. And if you see the data of National Highway Authority, they are the partnering institute, and you can see that There's seamless effort towards, making it available to each and everybody.
What can we do, especially from outside of the government?
A corporate is supposed to and is mandated to give 2% out of whatever they earn as profits towards the community development work. And this work that we are supporting with NCPEDP is part of that. So, if you know how the law is structured, it gives you 13, 14 areas to invest your money, and it tells you what all is required for developmental work. And very interestingly, work with people with disability is not defined, and rather, largely nothing is defined as it is, left to broad interpretation. And so the last 10 years in this sector, in this space, largely funds have gone towards health, interestingly, towards education, rather interestingly, and skill development. And we said that we need to look beyond skills. We need to incentivize skill in itself. And I don't have a better word, so pardon me, to the beneficiary or the last mile person who's getting the benefit of this, should also be incentivized to have social security around it, and which also had elements of insurance. What about that person's out-of-pocket expenses? You're skilling somebody with disability, say, but what is the incentive that, have you left him to just earn or find a job for himself or herself? Or have you incentivized enough his social well-being, his psychological well-being, his health well-being? So maybe micro-insurance can be part of the overall programming that CSR supports. And government should help the CSR community to kind of come forward and define this in totality for the community that we are trying to benefit, so that a larger community which I represent, start looking at this area very seriously.
We have a good understanding of what is the problem, both on the private side and the government side. But what can we do together as we meet together in Purple Fest?
I see a lot of excellent work being done, but I feel it's in pockets, right? And I find it difficult to talk to the stalwarts in the space, or know more things. Look, I'm really looking forward for a volunteer network where all these people, organizations can come together and can be accessible, can be reached by me as a common person, as a parent, caregiver to a specially enabled person, right?
Thing that I feel we need to do is take our policy document, draft out a policy document spearheaded by Emphasis and NCPEDP, and we all can join hands in creating an actionable strategy plan for the next 5 years, 2 years. That particular document should become a point of discussion in the Parliament, in the Parliamentary Committee of Health. There are 21 or 22 members in that, representing different states. We need to get a little ahead of all of what we are seeing. There's so much work so many people are doing. How do we bring them in the fore? How do we take their work as evidence and develop? It is not going to be easy, I completely understand, but this is my moral proposition.
What I was thinking is, we have a system of UDID cards. Can we somehow include some kind of a manual? So for me at least, I don't know where to start in the journey, right? Be it health insurance, be it upskilling, anything, right? A simple manual, simple pointers, simple QR code, kind of like a manual where I can go for next steps, right? Along with UDID card itself when it's being distributed.
I think advantage is when it is visible. You are able to, make a plea that much more easier, and there's a problem that you see. But when you are having a condition which is invisible, it looks like you are trying to scam somebody. You're using something, so it's very unfortunate. People with psychosocial disability, whether you have blood disorders or other neurological conditions and so on. And interestingly, Hari, the study which NCPEDP and Emphasis have done on the status of health insurance of people with disability in India, where we had more than 5,000 people from across the country with all disabilities participate. The highest number of participation came from thalassemia, the people who are having with thalassemia. So it's a blood disorder, disability. And the mindset that you have, that you need a system which fixes disability, the medical mindset of people and the medical model of looking at disability, I think we are in an era where everything is social, where we are very fluid in everything. We're fluid in our gender, we're fluid in our thinking in terms of your ideology. Nothing comes hard on you. But when it comes to disability, this idea of getting that you are already sick. All you need is to be fixed, and if you can't be fixed, then how can you get insurance? There is nothing wrong with us, nothing wrong with me, or nothing wrong with Evelino and so on. I think we are part of the human diversity. And the idea of health is not that you get treatment or medical support when you are sick. The idea is that you don't get sick. The idea is about wellness. Somewhere in our country, somewhere we don't think like that. It is not that I need a health insurance or anything else that I need is when I fall sick. You need support from health insurance so that you can do your everyday rehabilitation, your physiotherapy, your occupation therapy, or any other therapy that you do, a rehabilitation that you can do through that health coverage. If I am born or I acquire a disability at a certain age, it takes care of my entire life cycle support. If I was born with disability and I started using a wheelchair at the age of 12, and that is being also supported by the insurance which I have or my family has as a health insurance, that if you have a disability or you acquire a disability, it comes with the assistive technology support. Whether it is a spectacle, whether it's a wheelchair, whether it's a software that I need, or a hearing aid I need, or a blood transfusion. And it's not based on the event or incident that happened. It's a life cycle. So when I'm 12 or 14, I'm getting a wheelchair or a crutch, but when I'm 45 and I need a different wheelchair which fits my size, and I don't just buy anything which is available off the counter, that insurance company is taking care of that cost, so that it not an undue burden on me. I think that is how we need to plan. And it is not for disabled people, it's for everybody. Every year you need to do some treatment or something. So until and unless we look at something model which takes everybody along, I mean, we just can't be fixing people ki today is COVID, tomorrow is cancer, and then there's fever, and there's dengue, and there's malaria. You have to have a holistic plan. And what is the most beautiful thing about disability, Hari, that it does not discriminate with anybody. It can happen to anyone.
In my own experience, in my family, and when it comes to your doorstep, you realize how critical disability could be, leading to inability, and then people who seemingly seem able also seem very unable to kind of help or do anything about it. Sorry, a lot of words around able, disabled, but you realize, that's what it does to you. The out-of-pocket expenses is a big concern, and I came across this whole concern when I was working almost a decade back with truckers, and truckers especially who've met with accidents, who've met with, and now they are disabled, and the out-of-pocket expenses were so high, and we tried doing something about it back then. There was no law around it, but eventually it came. But I think it's still not able to fix the entire problem here. I think it'll take a lot of stakeholders to come together, not just taking it to Parliament would be one, but definitely yes. But yes, making a handbook and telling people along with your Aadhaar card or the other identification card that you have, that what all can you do, and have unlocking done through that. But also stakeholders like us, corporates coming together, is what my thing would be to say in the next 5 years we see things move at least in the right direction, at least from one of the stakeholders that I represent.
जैसे कि जो स्टेक होल्डर ही भेजते हैं, जैसे कि बाहर चॉइस सेंटर जाओ या फिर यहाँ जाओ ऐसा करके, तो ये ग्राउंड स्तर पे होना चाहिए जो स्वास्थ्य संबंधी कार्ड बनना, आयुष्मान कार्ड बनना, जिससे वो डिसेबल पर्सन आसानी से वहाँ पहुँच के अपना जो कार्ड है वो बनवा सके.
I just went through that NCPEDP report of 2025, and where I found that 41% about that they are not aware about ABPMJ scheme and how they can access or utilize the scheme. Also, I'm here, I'll just take a minute to share about the program that I'm looking after. It is Tele National Mental Health Program. It came in 2023, and it is a teleconsultation that we are promoting for mental illness, and anybody can utilize. It is 24/7, and the counselors are there, and also if the situation arises, they can escalate it to the second 2 tier where the psychiatrists are available. That is also 24/7. Just see that for last 3 days I'm in Goa, and trying to find out, evaluate the program, how much it has been penetrated to the community, whether they know about this program or not, and not a single person would be able to. While the government is trying to do the IEC campaign, and Goa is one of the best, performing states, still we yet to find that people knowing about this program. So it is important for all of us to raise the awareness and the accountability and accessibility.
As I'm navigating my own neurodivergence and psychosocial disability, I'm starting to shift to understand that it is not a condition that makes somebody disabled, but it is the world that disables people. How can we use insurance as a way to make the world more accessible, the world less disabling? No longer looking at insurance as a privilege, a gift that is available only to a certain minority, rich people, but a right for everybody, and a right especially for those of us who need it the most. Shall we all say together, insurance is my right? Yes.